Here we got Dr. Trevor Modlin. Trevor, it's nice to see you again.
Likewise, very good to see you too, Isidro.
Dr. Modlin has written a very interesting chapter for our next book. And the name of this chapter is Pain as a Subconscious Proof of Life, Medical Hypnoanalysis. We have to say that Dr. Trevor C. Modlin is a medical practitioner in private practice, and he's also a diplomate of the South African Society of Clinical Hypnosis. Trevor, we are very glad to have a contribution like yours to our book. And I'd like to ask you, how long you've been devoted to the practice of hypnosis, of clinical hypnosis and hypnotherapy?
Well, since 1986. I've been doing full-time since 1996. So that's 24 years full-time, yeah.
Mm-hmm. It was, it was a love at first sight?
I beg your pardon?
I mean, if it was a love at first sight, your love for hypnosis.
Oh, yes, for sure. Even when I was so inexperienced, I saw things that that just amazed me. So it was a love at first sight, and obviously I got more and more into it all the time.
Uh-huh. Well, you are an expert in medical hypnoanalysis. As you know, this term, hypnoanalysis, has been sometimes loosely used, but medical hypnoanalysis is something with an accurate description. What's the meaning of this term, medical hypnoanalysis?
It's a short-term but dynamic directed therapy, and it's termed medical because it follows a medical protocol, a detailed history, an examination, investigation when required, and then a definitive treatment plan. What I love about it, especially from South Africa, it's transcultural. It's a very powerful structured modality which emphasizes causes rather than symptoms, explanations rather than labels, and subconscious rather than conscious forces as being the ultimate origin of whatever problem presents. More importantly for me, which I understood with time and practice in it, it provides a much more profound understanding of guilt and spiritual issues, which are often the cause of a lot of pathology, medically and emotionally. You can sum it up by, in terms of pain, that spiritual and self-worth pain is commonly manifested in us as physical pain.
Sometimes in a passage of your book, Prisoners of Our Perceptions, you mention that sometimes we or our patients have a hole in the soul.
That's right, yes. That's an interesting concept for a lot of patients, because I see many patients with true guilt, which one can deal with once it's understood. But a lot of patients believe they have guilt when really what they have is shame. So guilt is, I've done something wrong, okay, be assessed, you get punished, whatever. But shame is, I am wrong. And that's the spiritual hole in the soul, that emptiness, which destroys people, unbelievably destroys. they have a tremendous inability to say, I love me. And it makes it very difficult for them to love others. You can't give something you don't have. So this hole in the soul is a very, very important session during the course of treatment. And it's quite remarkable, the change in people when they understood that difference and they're able to look at themselves in the mirror, give themselves a hug and say, I love me.
That's very beautiful. Dr. Modlin is the author of a very interesting book, Prisoners of Our Perceptions, Medical Hipnoanálisis Action. And in this book, you are recollecting very interesting cases taken from your files. Sometimes it is surprising because have been dealing with, we may say, untreatable cases. Sometimes lupus erythematosus or cancer, and I think you are an intrepid therapist to cope with this kind of cases that seem to be so difficult.
Well, in medical terms, they're very difficult. And autoimmune disorders like lupus are very rarely considered as curable by my profession. However, my experience shows without any doubt that every single autoimmune disorder I've seen in practice doing medical hypnoanalysis has a subconscious cause, and they're very eminently treatable with medical hypnoanalysis. To me, it's just amazing that it's ignored. We can help so many people.
Why do you think hypnoanalysis, well, we may say, generally speaking, hypnosis has been largely ignored, but more specifically, sometimes hypnoanalysis has been largely ignored. Why?
Well, to be frank, and this won't be enjoyed by a lot of people, there are two reasons, I believe. Number one, the pharmaceutical industry, and secondly, the process of medical hypnoanalysis and the success that it achieves, I believe, is threatening to individuals in the professions. Mm-hmm. I remember a long time ago when I first started utilizing it, I had a young patient with rheumatoid arthritis whose symptoms resolved, blood tests became normal. I approached a university to do studies. I actually offered my services for free to study 25 of their patients in their outpatients clinic and see whatever results we had and publish whatever results. And they asked me for a proposal, which I subsequently submitted to them, and I never heard from them again. And that's one of the big problems. This reticence, this resistance to opening new ideas, seeing things a little bit more broadly, and to work together. I mean, what we have for is the benefit of the patient or client, and that doesn't seem to happen.
Well, acute pain is well managed with some standard hypnotic techniques. Sure. But as you say, and other authors, as Dr. Ewing, for example, hypnoanalysis can be very useful in order to deal with chronic pain. What's your experience on it?
the majority of patients with chronic pain have a subconscious cause. In my book, indeed, in Prisoners of Our Perceptions, the first chapter is about a patient with migraine over a long period of time, to the extent he used to have migraines for up to 3 weeks at a time. He was about to lose his job. It was absolute disaster. And in about 14 sessions, it was all completely resolved. In fact, once we had completed his birth regression, his migraines disappeared. But his anxiety, his depression lifted by the end of his analysis. And he's done very well subsequently. So that's just one example. Certainly in the chapter I've written for your book, a patient with Crohn's disease, which involves a lot of abdominal pain and other symptoms, of course, his problems have resolved completely. To all intents and purposes, he's cured. Crohn's disease is one of the autoimmune disorders, and it's accepted generally by the medical profession that we can treat it, we can modify it, we can control it, but we cannot cure it. Well, I disagree with that opinion entirely. I reject that suggestion utterly. We can most certainly help people profoundly.
I agree. You have written on the subconscious diagnosis. Will you explain for us this concept?
Sure. When we take a history, when we see a patient, we actually make two diagnoses. There's the waking diagnosis, which complies with the DSM diagnoses, and they're the subconscious diagnoses, of which there are only 6. The difference is they help the patient to understand. They explain to the patient why this has happened, why you're feeling like this, and why this behavior is present. And those 6 diagnoses, the subconscious diagnoses, cover just about all psychological, psychiatric disorders, and I would think about 80% of all physical disease. The 6 diagnoses are quite simple. The first one is the prenatal experience, which is the perceptions of the fetus in utero, which models their whole personality from then on. Next one is the identity problem. This is a problem related to a loss of purpose, a loss of meaning, results in an existential void, which leads to another diagnosis I'll chat about very shortly. And the common problem here, the underlying problem, is the perception of the baby or a young child that there simply is no love for me. And it results in not just in that emptiness inside, that hole in the soul, it also results in a loss of worth and self-esteem. The next diagnosis, which is important, is termed the death expectancy syndrome, also known as the birth anoxia syndrome, because commonly, from the physical point of view, it begins in the birth canal itself. Because of the hypoxia, the terrible struggle to get out of the birth canal, the level of fear and panic rise. There's a sense of helplessness, exhaustion, until nothing more can be done in terms of the baby's thinking. That leads to another diagnosis, which is the walking zombie syndrome, which is probably the great contribution of Dr. William Bryan Jr. to medical psychology, the subconscious acceptance of death. In the birth canal, obviously that's an acceptance of physical death before it's actually occurred. But it can also occur at any level, and importantly at a spiritual level. If there's no purpose, no meaning to my life, then subconsciously one can easily accept death because life just no longer becomes worth living. Next diagnosis is the Ponce de Leon syndrome. Ponce de Leon was the gentleman years ago, 15th century, who searched for the fabled fountain of youth. So what it describes, the Ponce de Leon syndrome, is a patient who's become immobilized at a very young age in childhood and maintains that same immature thinking, the same immature emotions and behavior, which were appropriate perhaps at that age, but no longer serve any purpose to help the patient. So they get stuck there. They're unable to mature, basically. That's what it is. And the last one, very important, is the jurisdictional problem of guilt. This is a condition in where the patient, based on his or her education in terms of religion and social norms, the patient begins to judge him or herself, pass sentence, and punish themselves. And this is the basis of a tremendous amount of pain syndromes. The subconscious thinking based on their culture is, if I punish myself enough in this life, maybe I'll be accepted into heaven rather than go to hell. Very commonly we find in the word association test, which is our investigation in medical hypnoanalysis, when they're given the prompt, when I die, I'm going to, they commonly reply, hell. And when you reinforce that, when I die, I'm scared, I'm really going to, they say hell. And it's this, it's a proof of life. The pain in that situation is a proof of life, a proof of eternal life, a drive towards a forgiveness that will result in eternal life for myself. If I don't punish myself enough, well, then I'm just not going to go to heaven. It's very interesting. It's very simplistic, but that's the way it is. And it's quite easy to understand once we find out where that guilt first arose, understand what the faulty belief was that arose from that event, remove that faulty belief and replace it with the truth. And the truth in that situation is God is a loving being, not a punishing being.
You say that you are not against religions, but you are against some aspects, some pieces of religions.
Absolutely right, yes. We owe religion, formal religion of all types, a great debt. It's established a developed, responsible society over the years. No question about it. The moral standards, important. I have no beef against formal religion at all. What I'm not happy about is the suggestions provided to young children who are very suggestible, often in trance, that there are things such as hell, damnation, the wrath of God, and this type of thing. In fact, if you look in the Old Testament, the last 2 verses, it's quite threatening. This is what I'm not happy about, and it's on that basis that a lot of patients I've seen have developed serious pathology, psychologically as well as physically.
Well, as I have told you before, I think that you're a wise man, and you have introduced in therapy, well, these spiritual aspects that are so important sometimes and that are very often avoided by therapists. But I think that you are now facing something that is, I think, a very important point, a crucial point, the meaning of life. And this is something I have asked you before, but I would like you to repeat your opinion about this. What's the meaning of life for you and the meaning of life that you may perhaps transfer to the patient?
That's very simple for me, from my own experiences. The meaning of life, our purpose in life, is to be able to generate love, magnify love, and give love. One can achieve that genuinely. One has a pretty good life, a very balanced, wonderful life to lead.
Well, this is some beautiful words and a very authentic message that you are sending, and it is something that it appears in your book, in your highly recommendable book, Prisoners of Our Perceptions. And we are hoping to see the chapter also that you have written for our book, this pain as a subconscious path of life. And well, if you in the future, if you may come to Spain, I'll treat you to eat fine Spanish cooking and to have more chats about all these interesting subjects. Thank you very much, Trevor, and best wishes for you. I'll send you a virtual, I may say a virtual hug.
Thank you, and it's been a pleasure. Thanks very much, Isidro. I'll return that hug. All the best.
Okay.
May 2021 be a little happier.
Okay, thank you. Thank you. Likewise. Bye. See you soon.
Bye-bye.